Having a neuromuscular disease can sometimes be really hard because all your friends are outside playing hide and go seek while you have to go on your breathing machine, and you're not really a regular kid sometimes. But at MDA camp, you know that you are a regular kid because you're with people who are just like you. I was counting down for 153 days. I can't wait to see all my friends that go there. Leaving camp is probably the worst day of the year because you're basically leaving your family because everyone at camp just becomes one big family, and everyone's such good friends there. It's really sad.
When I was first diagnosed with ALS, it was a very sobering, diagnosis, and one that I definitely wasn't ready for at the time. The facts are that ALS is a fatal disease within 3 to 5 years of diagnosis. I guess in 2005 I started coming to Good Shepherd in Allentown to Dr. Hyman Patterson's clinic, and it's just been great. They've really allowed me to, I guess, not accept this diagnosis and this disease, because I don't. I'm going to continue fighting, till the end, whenever that is. So, in this day and age, we think we're a really advanced technical society, but yet there's a lot of diseases and things out there that we really don't know enough about. So, the MDA has done a lot and it continues to do a lot as far as fundraising and trying to get more awareness about, diseases, and, increase research to try to find cures.
To me, there's two ways that you can go about this disease. You can get really upset about it and let it ruin you, or you can grab it and kick it in the butt and use it to an advantage. I'm just like any other normal kid. MDA is what gives me hope every day. To be able to wake up and think, you know what, I might be able to walk someday. It's really a nice feeling.
I have CMT, and it slows me down a bit when I'm running, but it's not really anything different than just regular life.
It really hasn't dramatically affected our family's life, except for the opportunities that MDA has provided for him, such as the camp and the opportunity for him to give back to the community through his fundraising.
I've been a part of this program for a little over 5 years, and it's probably been one of the most rewarding parts of my job. It's not always easy because we are present when some of our families receive their diagnosis, and in a lot of those cases the diagnosis is ALS, and that diagnosis means that there is no cure. We let them know that the team will be there with them every step of the way, and that we'll make that road as easy as possible. But we do get to see some of our other patients with muscular dystrophy have some successes and get over some hurdles that they thought would be very difficult, and they're able to get through that, and we help them through that process.
I'm very appreciative of everything that the Muscular Dystrophy Clinic has been able to do for me. And I feel that without the leadership of Dr. Patterson, the other physicians, and the entire medical team at the MDA-sponsored clinic, I may not have lived to see my 33rd birthday, which I celebrated last month. Thanks to the Muscular Dystrophy Association, hope springs eternal, and long-term survival is not just a dream, but a reality.
When I can walk, I'm going to trade in my wheelchair for a Harley. Hope.
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 Hope.